Hi, everybody, and welcome. I'm Dr. Lisa. I'm a physical therapist and a specialist in osteoporosis and bone health exercise, and the founder of Brick House Bones. And today, my special guest is my BoneFit trainer and educator. I'm just really excited to talk to Dr. Kavita Patel today. We're going to talk about the right type of exercise for osteoporosis and low bone density. We're going to talk about how to work around injuries, how to manage safety, and why one-on-one training can really be a game changer for osteoporosis. So without further ado, let me introduce my special guest. Dr. Kavita Patel is a physical therapist with over 30 years of experience, and she's the owner of Move with Utsaha, a concierge physical therapy and bone health fitness practice in New Jersey, where she works with clients both in person and virtually. She's deeply committed to helping people, especially those with osteoporosis, to remain strong, active, and fracture-free. As a lead trainer for the BoneFit USA course through the Bone Health and Osteoporosis Foundation, and as a passionate educator, volunteer, and advocate, Kavita has shared her expertise nationwide, teaching courses, presenting at major conferences, and appearing on local news outlets. She was my mentor and teacher and has inspired me to do what I do. So it is my pleasure and honor to introduce Dr. Kavita Patel. Welcome.
Thank you so much, Lisa. I'm looking forward to sharing all this information. And it's been wonderful actually knowing you since you took the BoneFit training a couple of years ago, right, in Texas.
3 years ago, I believe, yeah.
Yeah, and very inspiring, and I'm so proud of all the work that you've done for the bone health community.
Yes, thank you. Wonderful. This is going to be a great conversation because you really have as much experience as someone can really have in this arena of working with people and teaching and educating and working one-on-one with clients to help them with their bone density and protect them from fracture. Really, that's what it's all about, right?
Yeah.
Tell us a little bit about how you got involved with BoneFit teaching and what has that meant for you?
Yeah, so BoneFit has been a great experience for me. It's so what it is actually, it's an evidence-informed training workshop that's designed for rehab professionals and exercise trainers, and it provides tools and strategies to help them design safe, appropriate, effective exercise programs for individuals with osteoporosis. And it kind of bridges the gap between research and real world applications. Throughout my career, I had a special interest in bone health and osteoporosis, and I developed programs where I worked that were really strong and powerful in getting the community involved, educating our colleagues across the state of Jersey, actually, and also nationally, in the best practices for bone health management. And so the opportunity to work with BoneFit was really just a good transition to what I had already been doing. And it's been so powerful because it just provides an opportunity to get so many people nationwide trained in the best evidence-informed exercise program. And it provides patients a way to find these trained individuals locally. And so they have the confidence that they're working with someone that's going to be aware of exercise movement precautions and design an exercise program that's going to benefit their bone health. It's also been very helpful for physicians to be able to find local providers and build some collaborative relationships in their local communities. And also so important for me is the wonderful connections that I've made with exercise professionals like you throughout the country. And we've kind of have developed our own little community. We're always kind of asking each other questions, reaching out to each other. Hey, what do you think about this case that I have? What's your input? And just learning about all the wonderful ways that they're working on raising awareness in their communities that we could all bring to our local areas as well. So it's been really just a wonderful experience, and I think it's going to have such an impact. The more courses we put out, the more people we train, the more people will have access to these, specialists in bone health management.
Yeah. I think the key you hit right there. One is having providers and patients have confidence in who they're working with, and knowing that they have training and background that's going to help keep them safe as we can, right?
Exactly.
And then the other is that the more people that do this, the more access we have. And I know that is at the heart of what you do as an educator and teacher and it's important to me as well that we have more of us available to serve more people, because that the people with osteoporosis are underserved. We know that they're greatly underserved. And thank you for your role in helping to fill that gap as much as possible. There's only one of you, right? Or actually several BoneFit instructors.
Yes.
But you mentioned there is a registry on BoneFit USA where you can look up with your zip code if there is a trained professional near you. And that's a really, really helpful resource for people.
It is. I've actually, so many of my clients have come to me directly through the BoneFit registry. And you can look it up. You can type in a search, BoneFit, find a professional, and you should get some links that take you right there. You enter the state that you're in, and it'll give you a list of providers and their contact information.
Yes, and that's, again, I've received several clients that way too, both from the client finding it and from physicians finding it as a resource. So it's really a nice way to bridge the gap there. So let's dive in then and talk about what are the exercises that if someone is newly diagnosed with osteoporosis and they're trying to figure out what is it I need to do, how do you approach that with a new client? And what are the exercises that really are a great place to start and make the biggest difference?
Yeah, so our first session is really a session where I'm getting to know everything I can about my client. And this is where our one-on-one sessions that we have are so important. I want to know about their bone mineral density, but also what is their fracture risk, what is their fall history, fracture history, what is their current and past medical history, what kind of exercises are they currently doing, and are they totally novice in their starting an exercise program, because that will really make a difference as to where our starting point is going to be. And if they are an experienced exerciser, what does their current regimen include? Does it hit all the main components of what should make up a bone health fitness program? Or is there something that they're missing? Is there something that needs to be tweaked on based on their presentation? I also want to know, what are their goals for exercising, right? What are they looking for? Where do they see themselves in 5-10 years being able to continue to do in terms of their physical function or participating in their recreational activities? What does their life look like for them 5 to 10 years from now? I also want to know, what is their exercise preference, right? We have a lot of people that are maybe a little nervous about lifting dumbbells, but they might be more open to starting to work with resistance bands. Some people may be nervous about going to a gym and they just feel comfortable working in their home. So I take all that into consideration, as well as what are their fears, because we know we've worked with our clinical population who have had to overcome serious injuries and health conditions. So they may be afraid of flaring something up. Maybe they've thrown their back out a few times in the past and they're afraid of their back going out again. They're afraid of pain. They're afraid of falling. So I take all of that into consideration before I start an exercise program, because there's no cookie cutter recipe, right? And it should be very individualized. And then the key components that I include in my bone health program, first of all, it's resistance training, balance, and functional training. So functional training is training movements that we do for our daily lives, right? Basic movements that we should all be able to do, and we want to preserve the ability to do those over the next few decades. I also include posture re-education, education on safe movements and body mechanics, and maybe modifications for certain activities, whether it's for our daily life activities, whether it's for work activities, or maybe our recreational activities, just to make sure that they are as safe as possible when doing them. So when it comes to our resistance exercises, let's say, I might start very simple, single joint, single plane movements initially, especially for a novice exerciser, just to get them used to using maybe the, dumbbells or resistance bands, getting used to the movement, and kind of, creating this sense of confidence in movement, in exercise, so that they can take that step forward to gradually advance the challenge of the exercise, and eventually leading to more complex compound movements that simulate our real world situations. So for example, functional activities that we incorporate throughout the day, there's 6 major components that I consider when I'm designing a more function-based strengthening exercise program. So those are movements that are pushing types of movements, pulling types of movements. So pushing, it can come into play. Let's say you're at the grocery store and you're pushing a heavy cart, right? Pulling, pulling open those heavy doors, right? Or pulling, like if you're going for a walk with your grandkids in their stroller, right? And you're having to maneuver their stroller over uneven terrain. You're going to have some pushing, pulling movements. Overhead press types of movements we should all be able to do. So think about if you travel a lot and you're putting up your suitcase up into the cabin, the top.
The overhead bin, yes.
Do that, right? And have the strength to be able to do those types of movements. I had someone the other day was telling me, I was able to push my window open. She had one of those windows that you had to push open, and she couldn't do that before.
Yeah, very practical.
Very practical. So we covered pushing, pulling, and overhead press. And then there's movements we call hinging types of movements, which are very important. It strengthens the posterior chain, so the muscles on the back side of the body, which we really need to maximize the strength in those muscles to help with bending, lifting, right, types of movements. And then we have squatting movements. So that's the 5th category. So squatting is an example of like a sit to stand, right? When we sit back down, it's a squatting type of motion that we do to be able to squat, to bend, to pick up something off the floor. And then there's also single leg squats, so kind of like a split squat or lunge, where it helps for when you need to get down on your knees. You got to kind of go down on knee and then the other. And let's say in the event of a fall, if you want to get yourself up, you want to be able to have strong muscles getting on one knee to be able to lift yourself up, right? So there are a lot of practical approaches there. And it also simulates movement that you do with stair negotiation, right? You have one foot up and you kind of have to lift up yourself. So squatting is a really important component, and there's so many variations of how you can train that. And then finally, there's carrying types of movements that we want to incorporate. So think about how it applies to real life. Think about carrying your grocery bags or a suitcase, a briefcase, right? And you can carry both hands, carry in one hand. And it also helps with grip strength, right? It's a good way to work on a lot of different components. Requires a lot of core activation, trunk stability, hip pelvic stability. So it's a really great exercise to include. So when it comes to resistance exercises, those are the 6 categories that I like to focus on once we've kind of worked on the simple movements, progressing up to that.
So let's list those. So there was a press or a push, a
pull, and overhead press.
Press, push, pull, press, hinge. Hinge, I think, is so important and
very important. Yeah.
Hinge, squat, and carry.
Carry.
Love it. Okay.
Yes.
So I love all of what you just said, and you just really said a lot, but so many important points here. You look at the whole person. Look at the whole person, their medical history, their fracture risk, as you're figuring out what's going to be best for them. What is their exercise experience? What will they do? I mean, what's realistic, right? You don't want to be giving people things that if it's really not something they want to do, to go to a gym.
Exactly.
So how do you help them where they are? And what's important to them? What's important to them in their goals now and as they look ahead over the next 10 years? And I absolutely love how you looked at exercise, because I think often we don't really see the carryover of what being strong means in our life. And what being strong means to me is my world stays big. I can travel. I can engage with young people at amusement parks. I can, like grandchildren and whatnot. And I can climb and hike mountains. I can go boating. That keeps my world big. And I've seen so many people that as they lose strength, their world gets smaller and smaller.
Yeah, perfectly said. Yeah.
And the activities that people love, gardening is a big one, involves a lot of carrying, pushing, pulling, all of the things you said. But when you learn the right strategies to protect yourself, then you know that you're improving your safety in doing those activities. So having those specific guidance for that can really be a game changer, can't it?
Absolutely.
Yeah, that's great. So in essence, what you're saying, if someone were to ask you, hey, Kavita, should I just be targeting exercises for my spine and hips because that's where the DEXA scan says I have low bone density, or should they really be doing full body resistance training?
Yeah, that's a great question. I get asked that a lot of times, like, why are we focusing on these other, body parts? And I really want to improve the bone density of my spine and my hip. And I always bring it back to, what is osteoporosis, right? It's actually a skeletal disease and systemic skeletal disease. So it's, the DEXA measures and reports bone mineral density in the spine and the hip, but it's kind of indicating what is going on in the rest of the skeleton, right? And so when we think about fractures that occur due to osteoporosis, we call them low trauma, low energy, or fragility fractures. They occur, in the spine and the hip, but also in the upper arm, the proximal humerus, we call it. They can occur in the wrist, they can occur at the ribs. So we really want to consider incorporating, a global exercise program that's going to target the whole body, the large muscles of the upper extremities, the lower extremities, the chest, shoulders, back. All of that is so important. And when you think about, resistance exercises, they can help with increasing in muscle mass, muscle strength, and physical function, right? And it can also help prevent, delay the onset of sarcopenia, right? So sarcopenia is closely associated with frailty, osteoporosis, falls, and fractures, right? So we really want to include a comprehensive global exercise program that's targeting the whole body, essentially. And when it comes to physical function, like movements like push, pull, carry, right? Upper extremity work. And, we know that to also for injury prevention, right? If you need to pick up something, if you have strong arms, strong legs, well, it makes the movement more efficient. So the load is not being transferred to the spine, correct? Yeah,
exactly. So that's protective. And I'm always thinking about what is going to be fracture protective. And we know that muscle strength, muscle mass, in the absence of change in bone density is protective, right? So that strengthening the full body without necessarily saying we're just looking at a change in your DEXA scan. Having increased strength is protective against falls and fractures.
Yeah.
And speaking of, really, most fractures occur due to a fall, correct?
Yes.
So how important is balance training? And are there better types of balance training than others?
Balance training is essential for any type of bone health program. As you mentioned, most fractures occur as a result of a fall, right? More than 90% of hip fractures and more than 45% of spinal fractures are a result of a fall. And so fall prevention is very essential component for preventing fractures. It has to be there. You cannot just work on strength. And in fact, research has shown that multi-component exercise program that focused on balance, functional training, in addition to resistance, decreased the fall rate and the number of people who fell. So important. So when it comes to balance training, it applies to everyone, not just those who are at a high risk of falls. It applies to younger individuals, active individuals. And we've noticed that, balance deficits actually begin decades before falls actually start to happen.
Absolutely.
And balance training should incorporate, I call it should target 4 different types, 4 components of a balance. So you have something we call anticipatory control, where you kind of prepare your body ahead of time before doing a movement. So let's say you wanted to put a foot on a step. There's a subtle shift in body weight that occurs onto the other leg to prepare you for that movement, right? You also have dynamic stability, which is being able to maintain your balance while you're in motion. So like while you're walking, while you're moving over obstacles, around obstacles, that you can maintain your balance and stability that way. Then you have something called functional stability limits. So that speaks to how far you can lean over in one direction before losing your balance, right? And so there's a flexibility component there. So if you're tight in your legs, you might not be able to reach too far, and then you kind of lose your balance. You have to step to regain your stability, right? So those are things that we want to address when it comes to designing balance activities, as well as something we call reactive control. So you want to improve your ability to react to perturbations, external stimuli that could throw you off. So think about if you're walking in the mall and somebody bumps into you, can you take that reflexive step to catch yourself? Can you get your arm out in front of you fast enough to kind of grab onto a wall if you lose your balance? So those are different components of balance that we want to include. And I'm such a big proponent of working on like coordination and agility. So you could be someone who is active, but you're playing, let's say you're pickleball player, right? Well, think about the movements that you do while playing pickleball that we can work on improving, because it's very easy to kind of get your legs crossed and you trip or something. But let's work on those movement patterns, improve your agility, your coordination, to make it less likely that you would lose your balance.
Yeah, I love that so much. So we'll recap some of that. People often practice single leg stance, and that is a foundation. So we need to be able to work on single leg balance, but that is static balance. And we tend not to fall when we're just standing still, but we fall when we add movement, whether it's just the movement of our head that's turning, the movement of our arm reaching for something, the movement of our legs stepping over an obstacle. So that dynamic balance component training is so critical to real life, how real falls happen.
Yeah.
And you added that anticipatory. How do we prepare our body to do a certain movement? Maybe it's stepping over a baby gate, maybe it's something that happens all the time, right? Or a puddle, or over a curb in the parking lot, and we're carrying things in our hands. So practicing these different real world skills. But I love your reactive balance training, that ability to take a step and prevent a fall. And that involves speed. That involves type 2 muscle fibers. That involves power and quickness. And we often stop training those skills. And those are sport-specific skills too. Like you talked about in pickleball, it's people get injured because they don't pick up their feet. Their foot gets caught because they weren't able to move it with that same speed and agility. So agility training, I absolutely love doing that with clients. We use the ladders and the blaze pods and things because they can retrain that ability to move quickly. And often they think, oh, I had to take a step, I didn't hold my balance. And I'm like, no, I want your body to be able to automatically take that stepping reaction and prevent a fall. And that's the stuff that really works, doesn't it?
And it's so important that you also challenge, progressively challenge your balance activities. So I often have people, when I test them on their first day and I do that single leg balance test, and most of the people say, oh yeah, I do this all the time. I'm really good at it. And they do it. They can hold it 30 seconds a minute. But then I'll ask them to do a little movement, maybe with their head or move their arms. And because they hadn't trained for that, they lost their balance very quickly. So we got to make sure when you master something that you don't stay there, that you move on to the next level of challenge, because you'll continue to progress that way.
Yes. How you train is the result. So I always tell people, especially with balance training, if it doesn't challenge you, it doesn't change you.
Yep.
And it's, doing that independently at home, you have to find ways to manage your safety. It's one of the things I love in the clinic is I can help protect someone and help put them in a really challenging situation, but help keep them safe at the same time as they wouldn't really be able to do in their home, right?
Yeah. Yeah, so one of the ways I learned this in one of the BoneFit trainings actually is a nice strategy to be able to perform some of these static balance activities in the house, especially if you do tend to have, some balance impairments, is standing in the corner of a room and you're back towards the corner and have a chair in front of you. And so you're surrounded, you're protected all around.
Triangle of safety right there.
Yes, exactly. And it gives the individual confidence that, okay, I can do this. I feel more confident. I'm not so nervous about falling. If I do lose my balance, I can lean on one of the walls or the chair in front of me.
Yeah.
But again, you want to practice this. It's not just the session one-on-one that we work together, but you need to practice these skills on your own, right? So we need to give homework and make sure that people can do it safely and confidently.
And set them up for success.
Set them up for success, yeah.
I love it. And confidence. Building confidence is key. How do you help somebody that's really fearful of moving? And take, for example, someone that maybe also has some other issues in their spine. Maybe they've had degenerative disc disease or other conditions in their spine. They've had pain off and on. How do you help them as they're really concerned about, is it safe for them? Is it appropriate for them to do this type of exercise?
Yeah. And in fact, many of our clients fall into that category, right?
Yes. Including me.
Yeah, exactly. We've all suffered injuries, some types of, setbacks and health conditions, and it could be a barrier to initiating an exercise program and staying consistent with it, right? So we do, I do try to understand and where they're coming from, what they're feeling. What positions or movements tend to be aggravating for them, and kind of work around that. I like to instruct some lower intensity versions of some of the exercises, things that they can maybe do lying down on the days that they do have some flare-ups of some, arthritic condition or spinal pain. And then on the days that they're feeling well, that we do some more dynamic, maybe higher level, higher challenge types of activities. But I let the client kind of guide me as to how they're feeling that day, so we know where we're going to be going. And these are strategies that I really like to improve their self-efficacy on, because we know the human body, as we challenge it, there are things that are going to happen that might set us back. We might have a flare-up, and it's not abnormal. It's very normal. But then I want to give them the tools for things that they can do, strategies they can implement to still be able to work out, maybe a low-intensity workout in the presence of pain. So even maybe some self-management strategies like breathing exercises, certain spinal stretches, elongation types of, movements that we learn in BoneFit that they can do anytime, anywhere, that often will actually help alleviate some of their symptoms. But they also feel like, okay, I am still doing something and I'm not totally inactive. And, I try to get clients to understand these cycles of, pain is normal, and kind of work through it, work around it, to be able to eventually get themselves back to the point where they can do more dynamic things again. And just understanding that, because many people don't realize, and if we don't explain that this can happen, they feel like, oh, I did something wrong, I'm afraid to do it again, maybe this is not for me. And just coaching them through that process is so important.
Yeah, I agree 100%. And especially when you have back pain and you have a history of osteoporosis, there's always in the back of your mind, did I fracture? Did I do something wrong? And so understanding that there are always strategies, and movement is medicine. Movement is really helpful. So having strategies to help people feel success and feel confidence, but knowing that it doesn't have to be high intensity and it doesn't have to be difficult, and that you work with them to find positions that help. So we have lots and lots of options when working with someone who may have an injury. But in these cases, in my opinion, I produce the videos on YouTube that are very general for people. But when someone has specific conditions that might need nuances or more specific guidance, that one-on-one training is really going to be critical to their success, right? To help them get set up on the right foot and moving with confidence and moving without injury and moving without pain.
Yeah.
Yeah.
And then getting people to understand their body and kind of also understanding what type of pain they're experiencing. For someone who's never exercised, they might be suffering from delayed onset muscle soreness, which is normal, presentation, normal symptoms after initiating a strengthening program. But for someone who's unfamiliar, might feel like, oh my gosh, my muscles are hurting. I must have damaged something.
Right.
And setting that expectation and giving them strategies to work through it, and letting them know that this might actually be a good thing, that you worked hard, but just give yourself a few days of rest. And so that the next time you do it, you'll actually do better. You'll perform better with that exercise.
Yeah. Fabulous. And then the other question that comes in often is other injuries. Say someone has their carpal tunnel surgery, and so they have one arm in a splint, or they have an ankle that's in a boot that's immobilized. And so they often ask, now I can't do anything, can I? And I like to say, yes, you can, right?
Yes, that happens quite often. And I call that, I say rest, but active rest for that injured area, but you can still work all the other extremities. You can still work your core, your back. And as physical therapists, we're so good at modifying, adjusting exercises. And, I always get asked, like, where did you pull that exercise out of? I'm like, we're good at modifying and creating different options for movement that will not affect the injured area, right?
Exactly.
And so it's so important, because you don't want to become deconditioned by if you had an ankle sprain and you're in a boot for 6 weeks. Well, in 6 weeks, you can lose a lot of muscle, you can get deconditioned. So you want to prevent that from happening while you're recovering, right?
Yes. And there's 3 other limbs that can work, and posture exercise and core exercise. And like, if you have one leg, like your ankle, that's in a boot from a sprain, and you're exercising the other leg, our brain is miraculous. And the exercise you do on your solid leg helps your other leg heal as well. It helps preserve the muscle. I remember learning that years ago.
And just maintains the neurological connections, and, neural adaptations, are going to be there.
Yes, I think that's just fantastic. What else? What else do you think you would really want people to know about osteoporosis exercise? Any myths out there that you want to bust right now?
Oh, yeah, there are so many myths. I'm always surprised when I hear certain things that people think or that have been told by other people. So you have, the extremes of some people get the diagnosis of osteoporosis and they freeze. Like, they're told, you could fracture at any point. You should stop doing all your activities. Be careful. Don't lift more than 5 or 10 pounds ever. Stop lifting up your grandkids. Stop playing golf or stop doing yoga. And then on the other extreme, you have people say, well, I was told I need to go to the gym and start lifting heavy weights, and I need to start jumping. And that could be quite intimidating for someone who's maybe never exercised, or, it's, there's no context. And, I think people need to find professionals who can guide them in, proper movement. Yes, you need to move, you need to exercise, but you're not going to, just easily fracture, on the other extreme, right? Though you're not going to fracture so easily just by doing your daily life if you are educated and safe movements, safe postures. So kind of bringing the reality, make them understand what options that they have. And so they're not intimidated, they're not fearful, but then they're not going to risk hurting themselves by doing something that their body was never used to doing.
Yeah,
Right?
totally agree on that. It's really important to me in training and working with clients to help them establish a solid base of strength before introducing necessarily agility or power or impact for those that it's appropriate for. It's not always appropriate for every person in every condition.
Yeah.
I'd love to touch base on two more things. One is the benefit of addressing posture and postural strength and posture mobility and targeting those muscles that do posture. And then the other thing I would love for you to talk about is mobility and how important mobility of our joints, especially our hips and knees and shoulders, can be in protecting us as well.
Yeah, so posture is something that I touch on during the first session. It's something that I want everyone to draw their attention to, be more mindful. What is, their ideal posture for themselves, and being able to find ways to improve their postural awareness throughout the day. So our static postures can often get us into a lot of trouble. How we sleep all night. Do we have a bunch of pillows under our head and we're stuck in a forward head posture all night? How do we sit all day when we're watching TV, when we're looking at our smartphones or doing any like needlework, if that's, reading, any of those types of activities, because we know that can cause the forward head posturing, causes our shoulders to round forward. And it's really a cascade of events that happen that can lead us to getting stuck in this alignment. I try to encourage to minimize sustained positions, sustained sitting, because it also affects, as we know, our hip flexors, right? Our hip flexors get tight. And then when we stand up, we may not fully get to an upright position. We're still we've maintained the shape of the chair that we were sitting in for a few minutes while we try to eventually elongate. And that's another thing. I like to use the word elongation of the spine versus making your spine straight. I don't tell people straighten up. I usually say elongate.
Lengthen, yes.
Lengthen.
I love that.
And that really just, it's like a click, like, oh, let me make myself taller. And this is something that they can apply throughout the day, whether they're cooking, waiting in line at the grocery store, whether sitting in the car, driving, right? So that's so important, drawing that attention, self-awareness of posture. And so that's something that I think we should all be doing all the time. And then not staying in one posture for too long, even if it's an ideal posture, because the human body was not designed to stay stationary for so long, right? We should be changing positions.
Yes, exactly.
So we don't get stuck in that position. Exactly. And then, of course, doing postural exercises. To me, it's a very important thing I do for myself all the time, because our modern lifestyle is such, we're always doing things with our arms in front of the body. We're leaning forward. We're not doing enough to open ourselves up. So my posture training includes stretching out the chest muscles, stretching out the hip flexors, and then strengthening, activating the erector spinae muscles, the muscles that hold our head up straight, that hold our thoracic spine a little bit straighter, right? And also in learning how to engage the core to help maintain that postural stability in anything that we do.
Yeah, I love that. I love all of that. What I want people to really take away from what you just shared, and that was a lot, that was wonderful, is that working on posture is protective. Working on posture is protective of fracture, and that, you just said another wonderful point about it. Oh gosh, I lost that. There it was. But posture is protective, and doing those. So almost anyone, regardless of their situation, can work on postural the component of bone health exercise. So I see lots of people that may have other, congestive heart failure. They have MS. Maybe they can't do some of the resistance training things, but some of these posture exercises can be within their wheelhouse. So there's always something we can do. And I love that. Okay, I've got it now. Remember, lengthen the front and strengthen the back. It's the combination of the two that really makes the difference. Because if we're still tight here, we try to do a lot of strengthening in the back, but it's going to spring forward again. So it's that combination of lengthening, decompressing, opening, and strengthening that really makes a difference, right?
Yes. Perfect.
Okay, last point, a little bit about mobility. How does mobility factor into this?
Yeah, mobility is so important. We want to be able to take our joints through their available range of motion throughout the day with our daily lives, but especially with exercise, right? And when I think of mobility, I think not just the joint, but also the muscles and tendons around that need to have adequate length to allow for normal movement to occur, right? So it's really important as we strengthen, as we get into more challenging movements with our strengthening exercises and with our balance activities, that we have adequate mobility of the joints and muscles and tendons to be able to do larger movements. It's just also going to help with our overall body mechanics. So for example, like the hip hinge, right? Mm-hmm. If we are tight in our hips, we are tight in our hamstrings, it's going to make our performance of the hip hinge very challenging, right? So we might need to break up that hip hinge activity with some mobility exercises and stretching exercises to allow us to go down a little bit deeper while maintaining good form. So I really feel like mobility of the hips and as well as our ankles, so important to be able to do any kind of like weight bearing activity like a squat or step up or lunge. If you're limited in ankle range of motion on either leg, it's going to affect the depth of the activity, right? So we need to consider that. And same thing with shoulders. So if you're going to be starting shoulder press exercise, well, do you have adequate range of motion and length of the surrounding tissues to allow for that movement to take place? Otherwise, you might need to modify it, not go so high, because then we don't want to risk creating injuries like a shoulder impingement condition, right?
Yes, exactly. Yes, I love that. Agree with all of that. And what I see, hip, knee, and ankle mobility, really, really important, because when we're missing one of those and someone is trying to hinge or squat, where they're going to make up for the losses in their spine, they're going to move their back more. So it limits your ability to put yourself in the safest possible position. And then also mobility of the toes, especially the big toe when it comes to walking and gait speed. And I agree wholeheartedly with the shoulders for being able to reach up and being in the most ideal position for supporting that load in a biomechanical advantaged way and decreasing stress on those tissues. Yes, wonderful information. I love this. I learned so much from you in our conversation, but also in BoneFit. And I'm really grateful for you taking time to talk to my listeners here today and for sharing your vast knowledge. And I hope we can do it again.
Absolutely. Thank you. I really enjoyed it. I love sharing this information. And it's always great working with you, Lisa.
How can people reach you? If they want to work with you, what's the best way to reach out to you?
So I have my website that you can visit. It's
we'll link it below. Yeah, go ahead.
And my email and contact number is there as well.
Good. Say that again. Move with
Utsaha.
Move with Usaha is your website. Wonderful. Yes. I love it. Well, Dr. Kavita Patel, physical therapist, thank you so much for joining me today.
Thank you. And thank to all your followers for listening in.